right, everyone. Welcome to our session today. We know that folks are joining our online learning space. My name is Aaliyah Wessela. I'm the CE director here, and I am on first to tell anyone who would like continuing education today what they need to do to make sure they get their hours. Some folks are still trickling in, so I'm going to give it a moment before we share our CE related information and then turn it over to our wonderful Curtis Center to get the program rolling. Give it a couple more moments because I know we're expecting a few more people at least to be entering our room. Thank you for joining us. You're in the right place. All right, I am gonna initiate my CE information process right now. So welcome to today's session. There is one continuing education hour that's available today for folks who would like that as part of their attendance. In order to earn your CE hour, we ask that you plan to stay for the duration of the session. And for any online courses, we're required to have some form of participant accountability. And today we're requiring some live polls. So those will pop up within Zoom, and you are able to just respond to the poll, and then that's kind of part of your attendance record today. So please respond to all of our live polls. Please stay for the duration of the session. If you have any questions about continuing education, I'm going to be here. I'll be monitoring the chat. Feel free to send those questions into the chat, and I will respond to those there. Let's see. I wanted to also let everybody know that we have a lot like captioning today. So please go ahead and turn the captions on if you'd like to see them. And if they're distracting to you, feel free to leave them off, but those are there for you. I think that is it. So again, my name is Aaliyah Wessela. I'm the CE director. I'll be in the chat if you have CE related questions, and please plan to respond to our live polls today. And without further ado, I'm going to pass it over to Dr. Jackie Hawkins to get us started.
Thank you so much, Aaliyah. I'm really thrilled to be with you all here today for our Curtis Center Health Equity Research and Training Health Equity Seminar. My name is Dr. Jacqueline Hawkins. I'm an associate professor in the School of Social Work for folks who don't know me. I'm also the acting director for the Curtis Center of Health Equity and Training currently, while Dr. Daphne Watkins is on sabbatical. And today we have Dr. Ed-Dee Williams presenting for us. He is currently a postdoctoral fellow at the University of Michigan School of Social Work in the Level Up Lab. And he's a research associate of the Curtis Center for Health Equity Research and Training. He's going to be transitioning to Boston College School of Social Work as an assistant professor in the summer of 2023. Dr. Williams' work examines Black and African American boys' experiences with depression and the mental health help-seeking behaviors of Black and African American boys and Black autistic youth, integrating Black youth's views, perceptions, and beliefs into available mental health services. Additionally, Dr. Williams develops and evaluates innovative simulation-based interventions to support Black youth and Black autistic youth's help seeking for depression and mental distress. He's also currently developing innovative ways to support Black autistic youth's mental health. And without further ado, I will give the stage over to Dr. Williams.
Oh, I'm muted, sorry. Hi, everybody. It's weird because I can't actually see everybody, so I'm gonna do my best to talk as I'm talking to myself and people in the room. But I'm really excited to be here. I appreciate you all having me. I'm going to share my screen now so you can actually see what I'm talking about here. There we go. Okay. So first, I just want to thank Dr. Hawkins and the Curtis Center for inviting me to share my work. And thank you all for coming today to hear about the work that I've been doing for the past about year and a half now, and really beginning to develop a new area of research that really has not been tapped into. So I'm really excited to share this work with you today. And just to give you some quick backgrounds, I know a lot of you all have to hang out the entire time to get your CE credit. So I promise I'll try to keep it as interesting and not as boring, so you don't feel like you need to check out. But today I'm going to share a little bit of background on autism and depression, talk about race and intersectional perspectives, and how we kind of blend and merge Black autistic youth and depression research. And then I'm going to share a brief study that I recently published that identifies racial disparities in autism and depression, and then talk about some implications for future work with autistic youth. And then we'll have a few minutes for questions and answers and comments as well. But before we get too deep into things, I want to highlight some common language that I use throughout this talk. I tend to use identity first language because this is the more commonly used language outside of academia, though primarily in the community, though I do occasionally use person first language as well. But identity first language really is about understanding a person's a condition that really has a social identity attached to it. And so really giving that identity to that person. So I tend to use terms like autistic individual, autistic youth, rather than a youth with autism. I also occasionally use the terms neurotypical and neurodivergent when differentiating between autistic youth and non-autistic youth. And though I recognize that neurodiversity includes multiple conditions beyond autism, that's just another one of the terms you may hear me use throughout. So I just want to make sure I'm transparent with that. I also use the term Black as an inclusive term. I'm very specific about using Black versus something like African-American. And not that it's an issue using African-American, but I use Black to include individuals with African ancestry that identify as Black. That includes Afro-Caribbean, Afro-Latino, bi and multiracial individuals as well, who don't necessarily identify as African-American. And then I differentiate between depression as a clinical diagnosis and depressive symptoms, which is the experience of depression without a formal diagnosis. So as you're experiencing some symptoms of depression, but you may not necessarily have a actual clinical diagnosis or be meeting criteria for like major depression or something like that. And then finally, I use the term youth often. Youth includes adolescents, usually described between ages 12 and 19 years old, but also include transition age youth, which in the state of Michigan is described as being between ages 16 and 26 years old. In some states, in some areas, transition age is younger and some a little bit older. But when I use youth, I'm usually talking between that 12 to early 20s. And I'll try to be specific in what age range I'm talking about when I use the terms. Also, I'll mention, if you can't tell already, I tend to talk pretty fast, and I'm going to do my absolute best to keep myself talking relatively, I'm not going to say slow because I can't talk slow. It's not something I can do, but I'll try to be less rapid. So let's talk briefly about the history of autism before we get started. Early records of autistic-related behaviors in youth appeared in the late 1800s and early 1900s. During this time, it was mostly described as a variation of schizophrenia and often referred to as childhood schizophrenia. And this is like early 1900s when psychiatrists and scientists really started kind of identifying some unique behaviors of youth who we now know would be considered autistic. Between this time in the late 1970s, several psychologists, psychiatrists, and neuroscientists described different forms of what we now refer to as autism. In 1979, Wing and Gold described the triad of impairment, triad of impairment, describing young people with deficits in social interactions, social communication, and social imagination, or rigidity of thinking, which is primarily defined by repetitive behaviors and compulsive behaviors. In 1987, autism was included in the DSM-3 for the first time, along with a new subset of mental health conditions called pervasive developmental disorders. In 1994, Asperger's syndrome, which was actually defined way back in 1944, but not included in the DSM until 50 years later in 1994. But Asperger's was included in the DSM-4, and often was described as a high-functioning form of autism, though it was not considered to be the same when diagnosed. And so if you had a diagnosis of Asperger's, you were not considered to be necessarily autistic. And around the same time in the mid-90s, the neurodiversity movement really began to take on life. And this can be, the neurodiversity movement really was an argument that those with neurodevelopmental disorders were not, did not have a condition that needed to be cured or fixed, but really a new, unique identity that needed to be considered in our society and treated and supported in a way that allowed them to flourish and live a healthy and happy life, right? So it really was a way of addressing society to better support and consider these individuals in a unique way. And then in 2013, autism was defined as a spectrum in the DSM-5, absorbing many formally identified pervasive developmental disorders such as Asperger's syndrome. And so what we now call autism spectrum disorder is what we currently go by. And this is including those pervasive developmental disorders such as Asperger's as well. And so autism, by definition, is a neurodevelopmental disorder, often characterized as poorly developed social skills, difficulty with expressive and receptive communication, and the presence of restrictive and repetitive behaviors. Additionally, some secondary characteristics also include unusual responses to sensory stimuli, difficulties with changes in surroundings, and stronger visual processing. And then, of course, autism is measured on a spectrum from high functioning to more dependent, lower functioning. And while autism is often discussed as a biological disability or neurodevelopmental, there are social aspects to autism diagnosis, both in the ways we assess and understand autism, as well as to the experiences of those with autism diagnosis. And so, like many mental health conditions that we often discuss, there is a socialized component to how we understand autism, and there are social consequences attached to the label. And some current data trends. Current data estimates about 1% of the world's population has autism. In the United States, about 1 in 4 children are identified as autistic. And current estimates put the rate of autism, in the US to be about 1 in 54. And I think actually it's now about 1 in 44. This is data, I think it's data from 2020. So somewhere between that 154 and 1 in 44 rate ratio, with an increase of nearly 180% since 2000. And so this is a rapidly growing population of young people that will call for significant increases in supportive services, tools, and funding, meaning there's a huge need for improved research, right, in order to really support and treat individuals with autism, but also a greater need for understanding the unique identities of these individuals. Current yet limited studies have found that throughout life, mental health problems are more prevalent in autistic people compared to non-autistic people. Current data reports that ADHD, multiple forms of anxiety, obsessive compulsive disorder, bipolar disorder, and major depression are the most common mental health conditions experienced by autistic youth. And so, surprisingly, in my interest area being in depression, depression among autistic youth is significantly understudied. When we talk about depression, we need to have a clear understanding of what we're talking about. Depression is characterized by a persistently depressed mood or loss of interest in activities causing significant impairment in daily life. Depression has a unique set of challenges when it comes to identifying it in autistic individuals. Depressive symptoms include pervasive depressed mood, diminished interest, weight changes, feelings of worthlessness, excessive guilt, sadness, and often reoccurring thoughts of death or suicidal ideation. And it is estimated that between 8 and 14% of adolescents in the U.S. between ages 12 and 17 years old meet criteria for major depressive disorder. And furthermore, nearly 21% of transition age youth in the US between ages 16 and 26 report experiencing ongoing depressive symptoms that impair their daily functioning.
Eddie, I am so sorry. I just, I wanted to interrupt really quick to ask about the poll questions and just to let us know when you'd like us to insert those.
Yep, sorry
Apologies.
about that.
No problem.
And I think I forgot to put the slides in here that say poll questions, so I'll just say it. Do it. And so, and though research on the association of autism and depression is limited, sorry, 1 second. Here, lost my notes. Though it's limited, there have been some studies that have identified an increased risk of depression amongst autistic youth. In particular, identifying depression among autistic youth is important given its association with increased isolation, long-term substance abuse, self-harm, and suicide, all of which are already disproportionately higher for autistic youth compared to non-autistic youth. Studies have found that between about 20 to 28% of autistic youth report clinical levels of depressive symptoms. And when we remove clinical levels and we just look at just the experience of depressive symptoms without an actual clinical diagnosis, that number has been found to be as high as almost 40% amongst autistic youth. Furthermore, studies have identified an abnormally high rate of suicide and suicidal ideation and suicide attempts among autistic youth. autistic youth are nearly 10 times more likely to die by suicide compared to non-autistic youth. That's a huge number, 10 times more likely, to the point that studies have actually found autism spectrum disorder to be an independent risk factor for suicide in later life. That means simply having a diagnosis of autism increases the risk of suicide when we look at this data. And oftentimes, many signs of depression, as well as suicidal ideation, are overlooked due to overlapping characteristics. Deficits in social communication and emotional expression can cloak depressed moods, sadness, and isolation. It can also make it difficult to express mental health needs and the severity of mental health challenges such as depression. And so help-seeking behaviors become unique because if you have a difficult time communicating your need, the experience of depression becomes more severe before it often is recognized. If that makes sense. Let's go ahead and do the first poll question.
All right, everyone, we've launched the first poll. If you're not familiar with these, you can simply click on the response options. And here we actually give you the option to click multiple because we know you may be wearing multiple hats. Again, if you're hopefully getting CE for your participation today, please be sure to respond to all polls. And if for some reason the poll is not working for you, do not be alarmed. You are welcome to provide your response in the chat instead. Thank you.
I think after this, we actually could do the second one too. I thought the second one was the first one. So we can
all right, let's, I'm gonna go ahead and end the poll here. So Eddie, I don't know if you could see our responses to your audience.
A nice combination of folks in here.
Yes. All right, and I'm gonna go ahead and launch poll number 2. Give folks a moment to respond. All right. Thanks everyone for your participation.
And so,
how are we doing?
Good. Okay. Good. There's some really good responses. I think, and the answer to that one will be everything, right? All the above. I guess will be the response. I should have had that as an option too. When we think about autism and depression, there's also a false perception that autistic youth do not have or experience complex emotions. And for a lot of us that have raised or worked with autistic youth, we can largely argue that that's not true by any means, but research has largely ignored the deep emotional experiences of autistic youth. In fact, for a long time, mental health experts did not believe that autistic youth could have mood or anxiety disorders. However, as we know, autistic youth are at increased risk of experiencing bullying. They often struggle with making close friends due to deficits in social communication and interaction skills, as well as stigmatized views of autism and autistic people in our society. There's a significant amount of stigma associated with autism that leads to behaviors such as masking and camouflaging behaviors, which are associated with increased risk of depression and mental distress. And just to put some context on it, masking or camouflaging is the intentional act of attempting to appear more neurotypical, right, or non-autistic. Autistic youth attempt to do things like make eye contact even when it's uncomfortable, ignore particular stimuli that would traditionally attract them, avoid talking about their interest, and avoiding difficult conversations. As a way of just trying to appear less autistic or non-autistic, right? And this kind of behavior calls for constant cognitive processing or social situations. So constantly being aware of the situation around you, who's around you, the people there. And so it really calls for to do this kind of camouflaging masking behaviors, to be aware of your surroundings, constantly be vigilant, essentially. And constant self-awareness and self-critique, to be aware of yourself and how you are acting or behaving in a space, and constantly critiquing yourself, right? And checking your own behavior. Interestingly enough, some aspects of masking is actually therapeutically supported and encouraged, even though studies have found it to be associated with increased psychological distress. So there's been some studies that have talked about parents who have encouraged their child to take part in masking behaviors, not realizing that the severity of psychological distress can cause it's associated with higher levels of depression, higher levels of anxiety, and even suicidal ideation. And finally, many of the symptoms of depression overlap with characteristics of autism, making it difficult to identify depression among autistic youth. And so behaviors such as social isolation, rapid mood changes, irritability, irregular sleep patterns, changes in appetite, and changes in social relationships are all kind of common characteristics of depression that often are also overlap with common characteristics of autism. All right. And when we think about the increased risk of depression and psychological distress for autistic youth, we have to talk about other identities that also increase the risk, which has really fed my interest in examining Black autistic youth and depression, because we know marginalized racial identities and social and racial discrimination are factors associated with increased depressive symptoms and distress. Before we do that, let's do the third poll question.
All right, we have launched the third poll, and I apologize. I realized that the chat was not enabled previously, and now it has been. So if you're having trouble with the polls, please feel free to use the chat now. A few more moments for folks to respond. Right.
That's great. So absolutely, changes in sleep, social isolation, rapid mood changes are common characteristics of both depression and autism. Hearing voices not quite so much, although there have been some studies that have found people who experience depression tend to experience some other psychological or neurological conditions that can lead to that, but that's not a shared trait between the two between autism and depression. And so while we're considering the overlap between autism and depression and the ways symptoms and signs are often misrecognized, we have to also consider how other intersecting identities play a role in autistic youth's experiences of depression and depressive symptoms. In autism research, we often overlook or fail to consider the interconnectedness of social identities, which is an important part of how these young people experience social circumstances that may be associated with depression. Intersectionality really calls for the consideration of multiple social identities that individuals embody. Looking at exploring oppression and experiences means you have to look at someone in their whole context. Who are they racially? Who are they nationally? Their physical and mental abilities or disabilities, right? Their sexual orientation, gender identity, these different things that all impact how we experience life and how we develop in our society and how we're treated in our society, excuse me. And so this calls for greater consideration of particular marginalized identities when examining a particular group's experiences with conditions such as depression. So my interest is really in how Black autistic youth experience depression, because research and lived experiences tell us that the social context around Blackness is associated with greater experiences of depressive symptoms. And so when we think about Black youth broadly, using at an intersectional identity, data shows that this group of young people are at a heightened risk of experiencing depressive symptoms. Black youth are more likely to report living in low-income homes, live in single-parent homes, witness greater community violence, and experience unique forms of discrimination and racism that other groups in this country do not experience often, if at all. And each of these factors have been found to be associated with greater risk of depression and depressive symptoms. Additionally, research has reported that Black youth are less likely than other Black youth are less likely than other racial groups to receive a formal diagnosis of depression, even though they often experience many of the social circumstances that increase risks of experiencing depression. But at the same time, Black youth, while they're less likely to experience formal diagnosis, they are more likely to experience depressive symptoms. They often report more severe symptoms and prolonged experiences with depressive symptoms prior to receiving the formal diagnosis. And so when we consider race, when examining youth experiences with depression, we get a more nuanced view of what this particular group of young people experience in regard to depression and depressive symptoms. And these experiences have to be considered in conjunction with other identities, such as being autistic. Just kind of continuing on this information around Black youth in general and depression, as I stated earlier, depression and depressive symptoms are significantly associated with increased risk of suicide, suicidal ideation, and self-harm, as well as drug use and physical aggression. As you can see here, the rates of suicide and depression is significant among Black youth. So data from this is from 2017, I believe. Suicide amongst Black males ages 1 to 19 years old, so any stage from early to late adolescence, was the third leading cause of death in 2017. From ages 20 to 44, it was the fourth leading cause of death for Black males. And data shows that over the past 20 years, rates of suicide among Black youth has increased by over 100%. In 2015, just under 1,700 Black children between ages 5 and 17 years old committed suicide. And what's interesting is that 70% of these Black youth were boys. Now, this is interesting because data also shows that there's a 3-to-1 ratio of boys diagnosed with autism compared to girls. So gender is also an important factor to consider as well as we talk about autism and depression in Black youth. And so returning to this point of intersectionality, we can begin to think about Black autistic youth as a unique intersectional identity that is uniquely at risk for experiencing depression and depressive symptoms, and all the outcomes associated with depression. Surprisingly, there is not much research on Black autistic youth other than research that has established that there's a disparity in age of initial autism diagnosis, in which Black youth on average are diagnosed with autism about 3 years later than white youth. And this disparity has been linked to delays in early interventions and greater rates of intellectual disabilities because they're not getting into interventions and support at an earlier age, which will make it more effective for them. Data also shows that nearly 25% of Black autistic youth have significant issues with conversation, language, and social skills that severely impair their abilities to adequately communicate their needs, compared to about 5% of white autistic youth. So that means some of the most vulnerable young autistic people are having a hard time really expressing their need for mental health care, social support, and other things like that. According to data from the 2018 National Autism Indicators Report, many of these disparities are related to contextual disparities that are associated with race and income, such as higher rates of poverty and a lack of access to adequate mental health services and supports. And what was most surprising is that after a thorough search of scholarly literature, I cannot identify any research on Black autistic youth's experiences with depression, which is surprising given Black youth's increased chances of experiencing the many social circumstances associated with depression, as well as Black youth's deficits in social communications, Black autistic youth's deficits in social communication skills, and late enrollment in many skill building interventions that would help improve their social skills and ability to communicate need. All of which, again, increase a young person's risk of experiencing depression and not being able to adequately address their need for greater support. So thinking about this unique intersection, and since there were no papers or research that I could find that explicitly examined racial disparities among autistic youth experiencing depression, I decided to examine this relationship using a small data set from a randomized control trial myself. If you don't find it, I guess go for it for yourself. It's helping me out so far. And so I'm going to share with you a little bit of a recent study that I published just a little over, just a few months ago, actually. And data for this study came from the baseline data of a randomized control trial of a virtual job interview training tool. Participants were part of a pre-employment transition services at 5 secondary special education programs in urban, suburban, and rural communities. And in this study, we had a total of 39 participants, 13 identified as Black and 26 identified as white. Each met the criteria listed here. So the criteria was transition age between 16 and 26 years old, because this tool was focused on employment skills. So we wanted transition age, had to have at least a 3rd grade reading level to participate, and a willingness to be video recorded in their participation in this tool that this data came from. And each met criteria, the only significant difference between the participants for Black and white participants was age, where Black participants on average were around 21 years old and white participants were around 19 years old. And this makes sense because, again, as I said earlier, we know that Black autistic youth tend to be diagnosed about 3 years later than white autistic youth. So this worked right on the button with the age difference as well. And there was this sample is largely male, 92%. The Black participants were male, 76%. The white participants were male. And again, given the 3-to-1 ratio of male to female autistic youth, this tends to be kind of right on the button as well. And we use bivariate analysis to compare reported depressive symptoms at baseline for Black and white participants. I'm not going to go too in depth with the methods, but I'm happy to talk about them more during Q&A. But depression was measured using the brief version of the mood and feelings questionnaire, and we used t-test and chi-square analysis to compare the groups with respect to the different variables. So we looked at differences in depressive symptoms at baseline for white and Black participants, and we controlled for age, sex assigned at birth, co-occurring disabilities, cognitive ability, and behavioral challenges. And this study was, sorry, just to plug myself, the study is currently published in the Journal of Autism and Developmental Disorders, so feel free to cite me. Our primary finding from this preliminary study suggests that Black autistic participants have significantly higher depressive symptoms than white autistic participants, which presents initial evidence of a Black-white racial disparity among autistic youth experiencing depressive symptoms. And so, notably, the rate of clinical depression was approximately 12% higher among Black autistic youth than their white autistic peers. However, this wasn't a significant finding, but it does call for greater examination of clinical depression as well beyond just depressive symptoms between Black and white autistic youth. But we see this higher rate of depressive symptoms amongst Black youth compared to white youth, and this was a significant finding. You know, let's go ahead and do I think we have one more. Two more. We have one more. Let's do number 4 poll question. Right. Can I go on to the next?
All right, we've launched poll 4.
Oh, I kind of give the answer away with this.
It's okay. Just making sure people are paying attention, huh?
I know once we get to the data, people kind of start zoning out. So go in right on time.
All right. Give folks another couple seconds to respond. All right, thank you, everyone.
Yeah, so it was a bit of a trick question, right? Based on this preliminary study that we conducted, we see that Black youth are more likely than white youth to experience depressive symptoms. But as of now, we don't really have much evidence of differences in formal diagnosis. So what this calls for, a need for a representative sample of autistic youth that includes race, depression, and risk factors, so that we can really examine this in amongst a larger population to see if what we expect to see, which is that Black youth report higher depressive symptoms and even at higher levels of clinical depression than white youth or youth of other racial identities. The matrix of multiple intersecting oppression experienced by Black autistic youth may explain the greater depressive symptoms. And so social injustices such as systematic racism, uniquely affect Black youth, leading them to experience greater depressive symptoms than their white peers. Black autistic youth navigate these same social circumstances while also navigating the many social inequities that are associated with autistic youth's increased risk of depressive symptoms. And for example, behaviors such as masking and code switching are associated with high levels of stress, feelings of loneliness, mental distress, and suicidality. And we talked about masking earlier, but code switching is very similar in that it's commonly seen amongst Black youth and Hispanic youth as well, in which they kind of mask certain behaviors, certain lingo, certain accents to try to blend in with more middle class white American kind of traditional behaviors, right? And this same behavior has been found to cause high levels of mental distress. And so these behaviors potentially contribute to a unique experience for Black autistic youth in which they're potentially engaging in masking and code switching behaviors. And this can facilitate increased levels of mental distress and result in greater depressive symptoms. Ultimately, it reinforces the need for the use of an intersectional perspective and approaches in autism research that specifically considers socio-ecological contextual factors that can uniquely impact the experiences of autistic youth. And so thinking about implications for future work with autistic youth, I want to return back to this slide on intersectionality and talk a bit more about the importance of considering the intersection of identity when discussing autistic individuals. So often autism is discussed as an individual identity, which leads us to avoid discussing other identities that could impact their experiences. Greater exploration of within group differences is needed to ensure that we are considering some of the most at-risk and vulnerable groups when examining the experience of autistic youth. research and data shows that Black autistic youth are uniquely vulnerable because there's a lack of understanding of the experiences, but also because there is known inequities in our society around who gets access to services and resources. Current data shows that Black autistic youth are more likely to live in neighborhoods that have lower access to mental health support, attend schools that tend to have either worse off or no transition services at all. And so in the time in which young people are experiencing often significant mental health challenges during the adolescent phase, teen years, and that transition phase, there also is a lack of support for other experiences of the autistic youth go through. And so in research on autism and the experiences of autistic individuals, we need to put a greater emphasis on intersectional identities. Identities such as race, ethnicity, gender, physical disability, and abilities, et cetera, all create unique experiences that have to be considered in our work. We also need to improve representation of autistic participants from underrepresented and under-resourced populations, such as Black youth. Additionally, there's a greater need for researchers and scholars of color in this field and area of research. That's my plug to bring anybody else into autism research. This comes down to better recruitment and intentional recruitment of Black and Brown scholars that can support these populations. If we think about organizations and groups that serve these young people, there needs to be a sense of trust and connection, which means we need greater representation on the research side as well. Greater representation means unique ways of thinking, unique ways of addressing issues, and unique access to different communities and populations. We need to examine potential disparities using large data sources. There are many administrative and representative data sets that have not been used, in my opinion, to their full potential when it comes to examining race and racial disparities in the experiences of autistic youth. In fact, in 2018, a systematic review of autism research found just over half the studies on autism published since 2010 actually reported the race or ethnicity of the participants. And of those studies, minority racial identities were significantly underrepresented, meaning that a majority of the studies that even mention race don't have a representative number of people of color in their study. In the same review, they found only 5 studies in the United States that specifically discuss racial and cultural adaptations of social skill interventions intended for autistic youth. There's going to be 6 because I just submitted one yesterday. So big thumbs up that we get a response. And while we are thinking about larger data to establish potential disparities and differences, we also need greater qualitative data to contextualize the experiences of depression among Black autistic youth, as well as autistic youth of other racial groups. And so that really calls for a use of qualitative and mixed method approaches to not only establish disparities if they exist, but also to contextualize the experiences. And so I'm actually in the process of doing some of this myself in my current work. My current research and the next steps for my work is to contextualize the experience of depression among Black autistic youth and develop innovative ways to support their access to mental health support for depression. I'm currently conducting a study that explores Black autistic youth's mental health literacy, help-seeking behaviors, and preferences for mental health support. I am in the very beginning stages of this work, but the goal is to gain a better understanding of how Black autistic youth experience depression and how to develop race and culture-specific mental health interventions for them and their families. So I'm currently conducting interviews right now. I just want to share quickly where I'm going with this work. Currently conducting interviews with Black autistic youth and parents and caregivers of Black autistic youth to really contextualize that experience and really get a sense of what they feel they need to be better supported. And so currently we have just about 12 interviews conducted, 5 from the youth and 7 from parents. And one thing that we've learned initially, first off, is that they want to participate, that Black autistic youth, the parents and caregivers of Black autistic youth want to be parts of these studies, and just reaching out to them, they're excited to be part of this, take part in studies. They want to be involved long term. They reach out to me, they reach out to people in my lab, asking to be part of these studies. They want to be included, they want their experiences known, and they want answers to the questions they have as well. So it really is a need to just reach out and tap into this population. Just in the initial kind of, in this really initial phase of open coding some of the interviews we have, what's come up is confusion at onset, really not understanding the experience when those symptoms first come about. right? Trying to understand what depressive symptoms are and identifying them early is an issue for a lot of Black autistic youth and their parents. Parental communication is a big issue where the youth do not want to go to the parents with their symptoms because they don't want to be a burden on their parents. They feel the parents have already taken on enough with everything else they're doing for them. But then on the other side, parents don't want to go to their children and ask them if they're depressed because they don't want to create a new burden for the youth. So it's an interesting emerging theme. Another one is social capital is a key to accessing support for the youth that I've interviewed who have been diagnosed with depression and are being treated. It has come from the parent knowing someone, a social worker, a therapist, a counselor who they can reach out to and ask questions and get clarification on. And then race, we found some race-specific themes, navigating racism and discrimination. All of the youth that we've interviewed have talked about experiencing racism and discrimination and trying to navigate that and understand what that experience is like for them. And also trying to address that and themselves and not really knowing how to. And then having this conversation around racialized events. So things like police shootings and police brutality. Several of the participants have said that they've had a hard time really talking about those things with their parents or with their youth or with their child when it happens. And some of that comes back to deficits in social communication and comprehension. So again, this is very early phase of this study that is ongoing, and we hope to have a larger amount of participants to really contextualize that experience. And thinking about implications for intervention in clinical practice, again, greater racial representation for practitioners and specialists. We need a greater racial representation of these individuals. Connecting our research to practice and do true community engaged research. Again, these participants and these families want to participate in these studies. They want to be part of it, but there's a lack of people reaching out to those communities, as well as people really truly engaging with them and keeping them involved in the research process, not just for a one-time interview, but making sure that they are fully involved and aware of where that data is going and how it's being used, and that it's impacting and benefiting them as well. And then for depression and suicide, we need greater improved clinical monitoring and support for Black autistic youth. We just don't have the data right now to know what's going on. And so we need greater clinical monitoring as well as data to really understand these experiences. And really speaking to innovative approaches to support mental health needs of Black autistic youth. The work that I'm currently doing is thinking about how can we use innovative interventions and tools to support help and positive help-seeking behaviors to support positive mental health literacy and things like that for Black autistic youth and their families. And that is the completion of my presentation. I want to acknowledge my research labs and partners that have helped me collect this data, supported me in this work, and continue to support this work as well. And I'm happy to answer questions and hear comments. Thank you.
Thank you so much, Dr. Williams. That was amazing work. And we're so thrilled at all of your success, and really look forward to what the future holds for this work. Such important work and relevant. We do have a few questions. I want to try to do my best to go in order. So the first question is actually in the chat. And it is, what is the formal name of the tool used in the parent study?
Is that the study that for the depression study? So that is the virtual reality simulation tool. I can't remember the actual name. It's a program called Virtual Interviewing with Rita and Travis, I believe. I can't remember the full name, but it's a tool that was developed by my mentor in my lab, Dr. Matthew Smith. And it's been, it's a great tool, has really great reviews, and has been measured and found to be effective in supporting autistic youth employment skills, interviewing skills, and just happened to be one of the data points that were captured in that data was depressive symptoms. And so we were able to use that to examine it. I have to think of I can't think of the full name of the actual tool, but if you go to Level Up Lab, you can see here on the site, go to leveluplab.org, and you can see all the data that's come out of that and the tools that we developed in that lab, and it's in there. But it's I believe it's called Interviewing with Rita and Travis. And I'm happy to talk more in depth about that. I would be lying if I said I can talk deeply about the methods around developing that, because I didn't develop it. I just used the data to conduct that initial study.
Great, thank you. So folks, you can absolutely go to leveluplab.org to learn more about that. Our next question is, how can we refer Black autistic youth and families to participate in your study?
Well, so you can email me directly and let me know. And I'm always happy to have more participants. The studies ongoing, and we need more participants. So you can definitely email me, reach out to me, and just let me know that you're interested, or you have a family who will be interested. I'll be happy to have a conversation. But just in general, we from the research side, we need to be more specific in saying this is the population we want, and thinking about how to connect with that population, but making sure we bring something to the table for them. And talking to a lot of Black families, is that they don't feel like they're being supported, that they're providing all this data and information that's going to build your career, but then they're not getting anything out of it. And so there's a need to bring that to the table. And from the participant side, there's a need just to kind of look out for these studies. There's always studies going on. A lot of these institutions, such as University of Michigan, Drexel, always have these kind of things going on. So really, it's kind of following them, seeing what's going on, and then reaching out to scholars who you see are doing research in an area that maybe you feel that you don't have enough information in, but you want to share with them. It works in that way as well. But yeah, email me if you have a family or someone who wants to participate. I'm happy to have more families and youth participate in the study.
Perfect. All right, great. So we have a little bit of a longer one here. So are you familiar with any studies that look at potential associations between Black racial and ethnic identity and depression for Black neurodivergent youth and adults? If not, I'm sorry, there's just a little bit of a second part. If not, have you seen any studies looking at associations between Black racial ethnic identity and other areas, such as quality of life, racism, et cetera?
Yeah, there's not many studies for Black autistic youth and depression or neurodivergent youth. In fact, like I said, before I published my study, I really couldn't find anything that was specific to Black autistic youth or Black neurodivergent youth. And that's not saying there's none out there, but there were none that I could identify. And we're hoping to change that as I go forward, because that's kind of the area that I'm in. But as far as research on Black youth broadly and quality of life and racism, that definitely exists. Now, if you mean Black autistic youth and racism, there's some literature out there. It's very small amount of literature, but there is some literature that has discussed experiences with racism in Black autistic youth. Most of that work tends to focus on families and how Black families kind of support autistic youth when they're experiencing racial discrimination. I have to think directly about what the citations of that. If the person you email me, I can probably send you or share with you some citations, but I can't recall them offhand. But there's very limited work. In general, there's very limited work around Black autistic youth broadly. That's just it's unfortunate, but that's the reality of it. I'm currently working with a group of Black autism scholars, and it's a small group, but we're doing really great work. But it really shows that there's not a lot of Black scholars doing this work also. And so sometimes even in thinking about who's doing the work and how it's coming out, if you're not having people who represent those communities do the work, why would we expect others who don't represent the community to do the work as well, right? So on both sides, but it's a very small amount of research on Black autistic youth experiences.
Great, thank you. Our next question is there any research on the impact of delayed autism diagnosis on depressive symptom severity?
On depressive symptoms, I'm not sure. I don't believe, nothing I've seen. There is quite a bit of research on the impact of delayed autism diagnosis around like social skill development, around enrollment and interventions, and long-term kind of communication skills. There's a good amount of work out there. And what's interesting now is we're seeing that delay and the disparity and delay actually change a little bit, where we're seeing more Black and brown youth being diagnosed at earlier ages. So it used to be 3 years, and now it's something like 1.5 years. And I think this past couple of years, last year and the year before, just current research has shown that there has been no disparity over the past 2 years, I believe. So we're seeing improvement in that. Some of that is from families becoming more aware of signs of autism, right? Being able to identify those signs very early and take them in and get assessed. Some of that is improvement in some of the clinical assessments as well. But I think it primarily falls into families are able to identify symptoms at an earlier stage because families are becoming more aware of the science of autism. And I think there's the stigma around mental health and autism in Black and brown communities is decreasing. So people are a little more open to saying, I think something maybe needs to be addressed with my child. I need to take them into a psychiatrist or a therapist and get them assessed. So that I do know that the research has shown that delay has decreased. But I don't know of much research that specifically examines delay of autism diagnosis and depressive symptoms. That'd be a great study, though, that maybe I could do in the future when we find the data that has that information. But I don't know of any currently.
Absolutely. And that is kind of a good segue into the next question, which is, are there ways in which clinical care looks different for Black autistic youth with depression compared to other Black youth or other autistic youth?
Yeah, I mean, I think so for sure. So we know that Black autistic youth are more likely to be nonverbal. They're more likely to be lower functioning. And then just in general, if we think about the context of Black families, of Black community, what is allowed to be shown publicly, how you're allowed to behave publicly is going to be different, right? We do see masking behavior more commonly amongst Black families because there's been a lot of stigma around mental health. And so the push to like have your child act more neurotypical or non-autistic may be common there. And we see that also in Hispanic families. There's a few studies that show Hispanic families tend to participate in masking behavior more often. So there's definitely, just in how people appear and how they act in public is going to be different, which again, assessing something like autism and depression are largely based on someone's social behaviors, right? And so if you're purposely altering your behavior publicly, that's going to change how someone can be diagnosed or how we recognize or identify symptoms. And it's also going to change what kind of services and support you get, right? So there's definitely differences. Again, the context of those differences just, I think in the research has not been thoroughly done. And part of what we're doing right now in my work and in my lab is really trying to contextualize the experiences of depression amongst this population and talk about what are those differences we're seeing.
Absolutely. And so we got a couple more questions that I believe you already answered in terms of if folks know of families who are interested in participating or participation criteria, to just reach out to you directly. Mm-hmm. Our last question here is about your current autism data slide. It just is asking for clarification. You mentioned 1 in 4 children in the US is identified as autistic. And so just some clarification about that. If it was 1 in 4 or 1 in 44.
Yeah, so 1 in 4 children are identified as autistic. The rate in which autism is present in the US is 1 in 44. So that includes adults, children, and not just who's being diagnosed currently, but who's been diagnosed over time as well. So currently the rate is 1 in, I think this says 1 in 54, this is 2020, so this is about 2 years old. But I want to say it's like 1 in 44 now. So this just may be off by a year or so, but that number has changed rapidly over the past couple of years. So when we think about in the current birth year, 1 in 4 children will be diagnosed with autism. We think about autistic people or individuals in the US as a whole, it's about 1 in 44. Hope that clarified.
Thank you. Thank you for that clarification. So we have about 5 minutes. If there aren't any other questions, though, I can go ahead and let folks go. We just want to say thank you again. I'm just checking the question one more time. So we want to say thank you again to our speaker presenting on your really relevant and innovative work. Like I mentioned, we're very thankful to have Dr. Williams as an affiliate of the Curtis Center for Training and Health Equity. We had a lot of folks turn up today demonstrating an interest in importance of your work. So thank you. We're excited to see what you do in the future. And thank you all for attending and being so engaged. So with that, unless Aaliyah, I don't know if you have any CE wrap-up comments before we let folks go.
I do. Thanks, Jackie. So anyone that's hoping to get CE, we will be looking at our attendance record, and anybody who's met our requirements will receive an evaluation from us by email. Those usually go out within a couple business days of the course. If my team is really moving along quickly, we hopefully will get those out to you tomorrow, but it's more likely that you'd be receiving that from us on Monday next week. So keep an eye on your email for the evaluation. And then after you've completed the evaluation, there will be a link to your electronic certificate you'll receive. And if there's any issues with this or you're not able to access something, please email our office and we will help you out. I'll put our email again in the chat so you can see it.
Wonderful. Right, everyone, have a great rest of your day.
Thank you.
Bye.